Hi, I'm Dr. Whitney with the Heart and Vascular Institute of Texas. I'm here to talk about the nuclear stress test. We perform stress tests in patients for two reasons. The first is to find out whether or not a person has blocked arteries feeding their heart. The second reason is to determine a patient's risk of having a future heart attack or dying from a future heart attack. There are two types of nuclear stress tests. The first is with traditional exercise, in which patients are put on a treadmill just like a normal stress test. The second type is a chemical stress test, which gives medications by vein which either stimulate the heart to beat harder and faster, or a medication which causes all of the arteries inside the heart to temporarily increase in size. These medications are given in a small IV, usually placed in the back of the hand. In the next few minutes, I will cover how the test works and the unique information that we can learn from the nuclear stress test. The main pumping chamber of the heart is similar in shape to the bottom half of a football. Here is the muscle of the pump, and here is the place where the blood is stored until it is pumped out each time the heart beats. If I were to slice the heart with a knife like this, you would see several donut-like shapes like this going from large to small. If I slice the heart like this, you would see a U-like shape, and if I slice the heart like this, you would see another U-like shape, but in a different direction. I can also slice the heart like this, and by so doing, separate every part of the heart muscle in all three directions. The arteries run on the surface of the heart. The small amount of the radioactive tracer that we give you during the test is carried in the blood and gets to the heart muscle in direct proportion to the amount of blood flow. If all of the arteries in the heart are open and the heart muscle has not been damaged by a previous heart attack, then the scan will look like several donuts going from large to small at both rest and with stress. The scan will also show several U's going from large to small at both rest and exercise. There will be a perfect match. If a person has had a heart attack, then a scar will replace the normal heart muscle. The scan in a person who has had a heart attack will show a defect or a blank space where the normal heart muscle should be. When looking at the donut-like shapes, it will look like someone took a bite out of the donut. This is an example. You can see the defect here. When a person has had a heart attack, the defect will be present at rest as well as with stress. It is what we call a fixed defect. During stress, with either exercise or with the medications, the blood flow to the heart increases 5 to 8-fold. When a person has had a blocked artery feeding part of the heart, the flow of blood to the normal part of the heart is much greater than the flow to the part of the heart that is fed by the blocked artery. This produces a defect in the scan that is normal at rest. If the artery that feeds this part of the heart is blocked, the resting scan will look normal, but the stress scan will show the defect. Whenever we slice up the heart into the donut-like shapes, we try to do it perfectly like this. The heart, however, sits in everyone's chest slightly differently. So most of the time when we make our slices, they actually go like this. Hence, in the top part of the scan, it will look like most people have had a heart attack, but we are really just scanning over the heart. The real advantages of the nuclear stress test are that we can see how much heart muscle has been permanently damaged by previous heart attacks, how much of the heart muscle is fed by blocked arteries, the risk of death with a future heart attack, and most importantly, whether or not we have the cholesterol blockage problem under control. If a person has a normal scan and 2 years later has an abnormal scan, this means that the cholesterol blocking problem has not been controlled and greater preventive therapy should be utilized. On the other hand, here's an example of a person who had an abnormal scan, and with aggressive preventive therapy with Zocor and other cholesterol-lowering medications, the scan has become normal. Here are some other examples. This is a normal scan at rest. you can see the normal donut shapes. With stress, you can see a small defect. This person has only a small part of his heart muscle fed by a blocked artery. The risk of dying should this artery become suddenly blocked completely, causing a heart attack, is relatively small. Here is another person with a large defect with stress. If this artery were to close off, the person would have a large heart attack and possibly die. We would be much more likely to treat this person very aggressively to prevent a future heart attack. Many people are scared by the thought of getting a nuclear test. The amount of radiation given to a person as part of this test is very small. It is equivalent to getting a chest X-ray. This amount of radiation is equal to the extra radiation that a person would get by spending 6 months in Denver, Colorado, rather than staying here in San Antonio, or working in a building made of granite. This is why it is safe for the physicians and technicians to be present with you during your test without special lead shielding. For the test to be accurate, you need to be fasting for 4 hours prior to your test. You may be asked to eat a small meal in between your rest and stress study. The reason for eating a small fatty meal between the studies is to ensure that the nuclear tracer is cleared from the liver and spleen prior to the next scan. This improves the quality of our pictures. Our technician will determine this at the end of the first scan and will inform you. The formal reading of the test by the nuclear expert usually takes about 1 to 2 days, so your results will usually be available to your physician within 3 days. Of all the tests that we have in cardiology to follow our patients, including the invasive heart catheterization, the nuclear stress test provides the best information on risk of future heart attacks and prognosis. I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas.